Have Ms. Helen Redmond, licensed clinical social worker for the Nicotine Harm Reduction Consultants. Welcome, Ms. Redmond. At your leisure.
Okay. Again, my name is Helen Redmond, and I'm a licensed clinical social worker, and I have a small consulting firm called Nicotine Harm Reduction Consultants. I am an expert in addiction, and I've worked with adult drug users for over 15 years in medical, housing, and mental health settings. And today I just want to touch on three things very quickly. One, vulnerable populations in smoking, the vaping hysteria that we are currently finding ourselves in, and the consequences of banning vaping devices or flavors. So the highest rates of smoking in the United States are among vulnerable populations, people who are homeless, people who have a psychiatric diagnosis, and people who use drugs. Those are the three populations. I have a few statistics. People who have schizophrenia, something like 64 to 74% smoke cigarettes, and they smoke a lot of cigarettes. People with depression, the numbers are somewhat similar. Bipolar, 69%. People who have alcohol use disorder, something like 70% of them smoke cigarettes. The homeless, if you see homeless people out on our streets, which we do every day, something like 78% of them smoke cigarettes. And smoking is really concentrated among low-income people. Something like 30% of low-income folks smoke. And these groups have very low quit rates. They're not quitting. They account for 40% of all cigarettes smoked in the United States. And here is a really tragic number that I want to bring home to you. People with psychiatric diagnoses die on average 8 to 25 years before the general population. That is a tragedy, and in my opinion, a preventable tragedy. Moreover, smokers are disproportionately people of color in the United States. So that is the populations, those are the populations that can still continue to smoke. That is where it's at, the most vulnerable and stigmatized groups. So in an effort to address that, I started a tobacco harm reduction vaping group at New York Harm Reduction Educators, which is in East Harlem. I facilitated this group. It was they were small groups. I provided them with nicotine products. And over the course of 3 months, the majority of them were able to switch from smoking combustible to vaping. And they were amazed at their ability to do that because they had tried over and over and over again with the NRTs, the patches and the gums and Chantix, which have a very low rate of success. We have to be honest about that. These products don't work for millions of people. And they were able to transition to vaping. And they were reporting, I can walk up the stairs without losing breath. The symptoms of my asthma are diminishing. They're reporting that the quality of their lives have dramatically improved. They like the flavored liquids. They like to use them. They like a variety of these devices. And so where is the concern among the people in this room for the most vulnerable groups of smokers who are dying because they continue to smoke? Why is there no national public health campaign to reach out to these groups? These are the people who are suffering the consequences, the morbidity and the mortality. Instead, we're focusing on a small group of teenagers, an obsessive focus nationally on this group, instead of the groups who are most vulnerable and stigmatized and have the highest rates of smoking. And so, related to this is the extreme anti-vaping propaganda and junk science that is being published regularly. And it's having a negative impact on the ability for tobacco harm reductionists to do research. I want to give you the example of one of my colleagues. Prior to this vaping hysteria that has ramped up enormously, he works with vulnerable populations. He had 3 organizations who were willing to recruit smokers, homeless folks, people who use drugs, to his study. Once the vaping hysteria hit, 2 of these agencies said, we're no longer going to recruit for your study. The third one said, you can recruit for our agency, but not if you use vaping products. The fear-mongering for them to back out of this research. And yet we're told over and over again, we need more research. We need more research. Where is it? Well, the hysteria that some of the people in this room are whipping up and maintaining is making it really difficult for us to do this research, which would give us more answers. So I want that to be noted. My second point, organizations like Truth Initiative, Campaign for Tobacco-Free Kids, Parents Against Vaping E-Cigarettes, they're directly responsible for whipping up and maintaining this vaping hysteria, this new iteration of reefer madness. These groups, in fact, are new iterations of the Women's Christian Temperance Union, Parents Opposed to Pot, and Citizens Against Legalizing Marijuana. And they want to ban vaping. And you know how they're trying to do it? By using their white privilege, their wealth, their power, their resources, their connections to billionaires like Michael Bloomberg to pass legislation which will disproportionately impact people of color and the most vulnerable groups. I'm going to say that again. There are organizations that are using their white privilege, their wealth, their power, their resources, their connections to billionaires like Michael Bloomberg to push through legislation that's going to harm the most vulnerable groups of smokers in this country. And I am outraged by that. I'm outraged that a small group of white wealthy people have the power to pass social legislation that's going to harm people who essentially have no voice in this country. My last point, prohibition never works. We're in the midst of an opioid-related overdose crisis in this country. Heroin is illegal the last time I checked. You can go out right now and buy a bag of heroin for $10. So prohibition bans do not work. And if you pass a ban on nicotine products, we know a black market will emerge. It always does. That is the whole history of prohibition in the United States. You ban a product, and right away a black market is created. And we know with illicit markets, there's no quality control. We know that products will be tainted. We know that people might die and they will be harmed. Again, the opioid-related overdose crisis. Heroin is cut with fentanyl, or it's just straight fentanyl now. And once you create a ban, you have to enforce it, right? It's against the law now to get flavored vaping and to get devices. You're a lawbreaker, so you have to involve law enforcement. Well, where is the NYPD going to go to enforce a ban on vaping products? They're going to go to the neighborhood where they murdered Eric Garner. They're going to go to NYCHA. They're going to go to communities of color. Does anybody here remember Stop and Frisk? Who did they target? Young people of color. That's who they targeted. And I believe that's who they will target. And that's why I am opposed to any kind of ban. And I want to leave you with one question. Well, before I leave you with this question, there's no unintended consequences to bans. That's over. If you pass bans, you have to understand that these are the intended consequences. We've had a drug war for a century. We know what the intended consequences are now. So I want people to own that if they pass a ban. You know what the consequences will be. And I'll just leave you with this question. Have we learned nothing from the racist history of drug panics and prohibition in the U.S.?
Thank you, Ms. Redmond. Thank you for your testimony, Ms. Redmond.
No questions?
I actually, I do not, yes, I think that your point was made quite clear. And there's a lot of what you're saying that certainly I have to seriously consider, and I believe that most of my colleagues will probably do the same, as it relates particularly to an outright prohibition.
I would like to
If I-
come back again as an expert on addiction. I want to come back
Yes, ma'am.
on this dual use question. So if anybody here has ever tried to change a behavior like lose weight or exercise more or eat better, did you do it all at the same time? Did you do it in a week? Did you do it in a month? You didn't. You tried to eat healthy, but then maybe you sneaked a Big Mac or you ate a pint of ice cream. You started working out, but then you took 2 weeks off. This is precisely what is happening with people who are transitioning. It's called stages of change. It takes people time, especially people who have severe psychiatric problems, who are using other drugs. It takes time. And what we have to do, and what I did in these groups for 3 months, I hung in there with people, right? They would come back and they said, you know, Helen, I had a couple Newports. Don't worry about it. Most of the time you're vaping. Let's move down that continuum. So I'm not alarmed by dual use. It is normal and natural when you're trying to give up an addictive, or I would say a dependent, being dependent on one sort of, drug and then transitioning. So we should not beat up on people who continue to do both. We need to have empathy for those people and work with them to move them down the continuum.
Question, Ms. Redmond, about about the research aspect that you talked about. Is you said there were 3 agents, excuse me, 3 organizations that you were working with to actually do some level of research, right? And that you said that 2 of the agencies at one
This
point
was a colleague of mine in another
yours.
state. Yeah.
Okay, in another state.
Right.
Are you familiar with any efforts in the state of New York that is similar as it relates to organizations recruiting people to perform any type of research? Because in that case, do you know what state? Do you know? Can you mention the state?
California.
So in the state of California, the research was being funded by a private entity, I
Yes.
figure? Okay, so in other words, the what was described by the doctor that spoke before you about the difficulties of gaining money as a federal grant to do the research, they were getting around it by having private money do it in California?
I guess what I would say to that is because of the vaping hysteria, people are so afraid now. And fear is not a good thing. Fear shuts down debate and rational debate and discussion. And so now I can just tell you, when I've gone back to New York harm reduction educators, and we do want to do studies there, we want to do clinical trials, we want to be able to follow people.
Right.
They're concerned about these products. They haven't said, no, Helen, we won't do research, but now they have all these doubts. And I can only believe that's happening all around the country.
Right, but in the case of New York, are you familiar with instances where there is any type of institution that is performing some level of research like the one that was attempted in California, and as you said, your colleague...
Yes, and NYU is actually.
NYU is, not the... I'm not sure, the gentleman, I think he might have left, but so NYU was doing something with private funding to your knowledge?
Yeah, I'm not sure what you're trying to get at.
No worries. That part of it is that the idea that you made the point that we are asking for more research, and yet we are making more research less possible by what you deem a hysteria. So I wanted to kind of dig deeper into that particular case that you described in California and see whether there was something similar that was happening in New York, and whether we could see something in New York. All right. Thank you, Ms. Redmond.